This video continues Chapter 11 of OEC 6 by looking at altered mental status and specifically signs and symptoms of some medical conditions that would lead to altered mental status. We'll also talk a little bit about two types of stroke and the diagnosis, rather the assessment of someone who's having a stroke. Some key terms that we'll see related to diabetic emergencies. We'll see the idea of hyper and hypoglycemia. Related to epilepsy, we'll see the ideas of clonic and tonic activity, and we'll talk about generalized and absence seizures. So for conditions associated with AMS, the first one to consider is epilepsy, which is a chronic medical condition that causes seizures in an individual. And a seizure is this electrical disturbance in the brain that can cause alterations in sensory pieces, their awareness, attentiveness, and so on, or in their motor behavior with some specific body movements. Signs and symptoms of seizures could be either mild or severe, but in the most dramatic form, you can get violent spasmodic movement, tonic and clonic motion, even though this will only last about 1 to 3 minutes. To distinguish, we have two types of seizures to consider. The first is a focal seizure, or sometimes called a partial seizure, that's just localized to one part of the brain. Here we see an ECG for normal brain activity and the electrical function that's there. In an epileptic seizure that's focused on one part of the brain will have that increase in electrical activity, while the other part of the brain matches the normal pattern that we see up above. In a generalized seizure, we see that increase in electrical activity in all parts of the brain. Now, these seizures can be either simple or complex, relating to how responsiveness is affected, and once again, they may involve either sensory changes or motor changes, depending on that electrical activity. A simple focal motor seizure can result in movement of just a specific muscle group. For example, just facial twitching or tensing of the torso muscles. A focal sensory seizure will lead to blurred vision or seeing spots or perhaps an abnormal smell. Generally, a partial seizure or a focal seizure does not result in a loss of responsiveness. A generalized seizure, however, can affect both sides of the body equally because the entire brain is included, and we can see a decreased level of responsiveness resulting. In the mildest form, that generalized seizure is a petit mal seizure or an absence seizure, in which the episode may last for less than 15 seconds and is represented by an absence of affect in the patient, a vacant stare, or sometimes rolling of the eyes. In a grand mal type of seizure, this is the most common type that may occur. We also can get motor function apart from an absence seizure where we have tonic and clonic activity. Tonic activity is contraction of the muscles and the patient's going to stiffen. In clonic activity, we see spasmodic movement of the extremities as the muscle groups spasm. So the three phases time-wise of a generalized seizure or a grand mal seizure are pre-ictal, ictal, and post-ictal phases. The pre-ictal phase is occurring before the seizure, and the patient may actually know that a seizure is on its way. They may report an aura, which is a distinctive feeling or sensation that the seizure is about to occur. They may present with some sort of an auditory sensation or a visual hallucination in this post-ictal aura as well. The ictal phase is where we see, first of all, the tonic behavior in which the body is very rigid or stiff, and that's followed by the clonic behavior, which may last for several minutes. During this time, the patient is going to be unresponsive. We may have grunting or grasping sounds, clenching of the jaw, and in some cases, we'll actually see cyanosis just because of the hypoxia resulting from clenching the jaw and the inability to breathe. This will last about 1 to 3 minutes. longer than 3 minutes, we're going to see increased hypoxia. The postictal phase after the seizure has occurred is when the patient may be minimally responsive and in some cases may actually become limp. They may lose control of some bodily functions as a result, and they may void or defecate due to relaxation of the urinary and anal sphincters. But over time, they'll become a little bit more aware of their surroundings and eventually return to being fully alert. Now, status epilepticus is this idea of a seizure lasting longer than 10 minutes, or a prolonged postictal state, or 3 or more seizures back to back without regaining consciousness. And this is a medical emergency because of the potential for permanent brain injury. Why? Is because in this seizure state, we're going to quickly deplete the brain of the glucose that's there, and brain cells burn a lot. So consequently, we can end up with destruction of those brain neurons. Brain neurons as well are that extension to the nerve cell, moving across those synaptic gaps, and the electrical activity can have this destructive effect as well. So the body's pretty effective at maintaining glucose in the blood. And in the case of a seizure, we can burn through it pretty quickly. But what if a particular cell just can't get an appropriate supply? Well, that's the case of diabetes. Normally, blood sugar in your body is between 140 and on the high end and 80 on the low end of milligrams of glucose per deciliter of blood volume. That's going to change whether or not you've had a recent meal or so on. But in diabetes, you just can't regulate the blood sugar level effectively, and so the glucose in the body is higher than this range of 140. So diabetes mellitus is a chronic disease in which either the pancreas cannot produce enough insulin or your body cells don't respond to the insulin. And so we'll talk about type 1 and type 2 diabetes. Now, physiologically what occurs is when a person eats a meal, glucose goes from the small intestine into the bloodstream, and then the pancreas secretes the insulin that helps that glucose move across the cell membrane into the cell to be used for energy in the mitochondria. Excess glucose will make its way to the liver for storage after conversion to glycogen or storage in the muscles or fat as well. If not enough insulin is present, glucose cannot either enter the cells or be stored, and so it just hangs out in the bloodstream, and we get that high blood sugar level of greater than 140 milligrams per deciliter. So the long-term consequences can be pretty severe. Let's look in more detail at the two types. Type 1 diabetes was sometimes called juvenile diabetes because the diagnosis would happen early in life for children or teens or young adults. The cause is the pancreas just not making enough insulin. Consequently, the treatment for that is insulin injections. And we see here just a reminder of that physiology. When glucose is available in the bloodstream, after moving from the small intestine to the bloodstream, it's insulin acting as kind of a lock and key fashion on the surface of a cell that opens up a glucose channel in the cell for glucose to enter the cell and then be used for energy. In type 2 diabetes, which was sometimes called or is still called adult onset, the key is your body may be making insulin, but your body is resistant to it or doesn't produce enough insulin to just maintain that glucose cell. The cells don't use the insulin. Sometimes it's called insulin resistance, therefore. Now, type 2 diabetes, because the insulin is present and perhaps just the ability of the cells to use it is limited, we find that with adult onset diabetes, you can treat it through things like weight loss and exercise or consideration of the meals that you eat, maybe avoiding simple sugars to avoid high blood glucose levels. So in either type, what can happen is a diabetic emergency of either too little glucose in the bloodstream or too much glucose in the bloodstream, hypoglycemia and hyperglycemia. In the case of hypoglycemia, we have too little blood sugar, and what may cause that is an excessive dose of insulin or other hypoglycemic medications, or perhaps not intaking enough food followed by exercise, which in the ski patrol world could be a likely cause. Some of the signs and symptoms: not having enough sugar in the bloodstream, and the altered mental status that can occur is confusion or disorientation, being lethargic, slurred speech, or in some cases even seizures occurring. Hyperglycemia, the opposite, too much blood sugar, also presents itself with some particular signs and symptoms, but in this case we may encounter polyuria or polydipsia, dehydration, rapid pulse, lowered blood pressure, and this is one that occurs just because of a condition called ketoacidosis, sweet or fruity breath. Escalating blood glucose level builds up ketones within the blood, and so consequently that acidosis can lead to some pretty severe outcomes. Now, hyperglycemia occurs much less than hypoglycemia, and the onset is much slower. Many children and adults who are undiagnosed diabetics initially present with some of these signs and symptoms, and so that may be a consideration if you have someone with AMS and it's not a traumatic cause and your sample history uncovers no history of diabetes. Moving on, another cause of AMS is a stroke, which is essentially low blood flow or lack of blood flow to some area of the brain, and these occur in two basic types. You can have a block, which is an ischemic stroke, or a bleed, which is a hemorrhagic stroke. So ischemic strokes, because they're a block, are called dry strokes. We don't have the bleeding inside the brain. We do have a blockage. We do have disruption of blood flow to some part of the brain, and 80% of strokes are ischemic. The primary cause is an embolus, which is a traveling clot that makes its way to one of the arteries in the brain. Now, these emboli can originate outside the brain, and they could be some sort of a plaque that breaks off from the carotid arteries, could be a blood clot that travels somewhere else. So that blockage in the brain is going to result in lack of function in the brain just simply because of a lack of blood flow to that particular part. Now, the second type is sometimes called a wet stroke because it's a bleed. It's a hemorrhagic stroke. And so if you get rupture of one of the arteries or smaller vessels in the brain, blood will go to the surrounding brain tissue, but it doesn't directly deliver oxygen and nutrients to the brain cells. Also, you can end up with direct pressure on the brain tissue. You can end up with a hematoma. The most common cause is some sort of a weakness on the wall of the blood vessel, and the corresponding aneurysm that occurs can eventually burst. So depending on the size of the ruptured vessel and how much of the brain is affected, that hemorrhagic stroke could result in some severe consequences, including death. People with high blood pressure are going to be at a higher risk because we're talking about a bursting of this particular blood vessel. So for all of these cases, just consider that AMS is a serious problem. Something's wrong within the brain. Some of these will be life-threatening, such as what we described in the case of hemorrhagic stroke. The symptoms are going to vary widely, and some of them can present in very subtle forms.